Hey everybody, so I thought I would do a video update. Definitely just going to be a lot easier to explain everything that we've learned today. Some of you may know that Jason had a follow-up appointment with his neurosurgeon. It's 4 months post-op, but he had the appointment, so we went. Long story kind of short, he has tumor growth. His brain cancer has grown. It is from the original cancer, probably, the original tumor. It is right where this spot was. The recession is what they call it. It is a little nodule, a little, he kind of called it a knobby that, has grown off of that. It is not all bad news. I mean, I know, it sounds like, Jason's tumor has grown. That sounds scary. But we actually left feeling really good about everything. Couple of reasons why Jason has not felt well lately. He has not been himself. He has not been having seizures, but he's on a lot of seizure medication. But he's been, of course, very low energy. He has just not, it's almost like he's not connecting things. I mean, it's just, you can tell his brain is just not firing correctly. So that's tumor related. All this time, we ask, questions, or, you talk to your doctors and, it's, oh, well, he's just coming off of radiation, or he's coming off of chemo. And technically right now he's back on his 5-day treatment of chemo, which is a really strong dose of chemo for 5 days. And he will do that every month for a year. But anyhow, that's the answers that we're getting, but I didn't feel that was right. The past few mornings he's been having headaches, and I give him a prescription ibuprofen, and it helps. It takes it away, and he's fine, as far as pain goes. But anyhow, we went to the appointment, and I had actually printed out the dictation from his last MRI. His last MRI was December 31st down at Cancer Treatment Center of America, CTCA. And, I had said in a previous video, we kind of had a little bit of conflicting doctors' opinions as far as what it was looking at. It turns out that it's not just pseudo progression, which is like basically a false progression look on a radiation scan, or a residual radiation, because when they did his last MRI, it was pretty close to after he was off of radiation. So, you can, radiation is going to light up. That is what his radiation oncologist thought that it was. And it's not to take anything away from him, because we love him. We think he was an amazing doctor. But it's the importance of getting not only second opinions, but as with all my videos comes a public service announcement kind of thing. It is important to keep all your appointments. There was a small part of me, I mean, small, maybe 5% part of me, that thought, this is 4 months post-op. We've seen this doctor every month since surgery, but, it's basically, how things going. Well, 4 months post-op, he doesn't have anything, I didn't think, like, I even made the comment, like, I'm going to ask him these questions because, I had a list of questions I was going to ask. I'm going to ask him all these questions, but I don't really know how many answers we're going to get because, he doesn't really, he's not part of Jason's current care, as far as he's not his oncologist or his radiologist or even his neurologist. He was his neurosurgeon. But boy, was I wrong. And I'm so glad that I was. It's important to keep those appointments, because maybe not all doctors are like this. Obviously, you've got some that are better than others, but this doctor, before we got there, he had requested those scans. He had gone over Jason's scans and already set up a plan of action. And that's what this is. The plan is to go in and to get that tumor. So he will be having another brain surgery, which doesn't sound as scary now that we know, one, to what to expect. Two, he feels like he can get it all. We see Dr. El Shahabi in Atlanta, and he's recently moved office locations, and he has ensuite surgical, a surgical ensuite. Obviously, you don't do brain cancer in an ensuite, but the point is, he had a new location that we went to today, and he was saying that along with moving locations, he also has moved hospitals that he works out of. When Jason had his first brain surgery, it was what he called like an emergency surgery. If you've been following, you know that we were in his office when, and they had to call 911. And the ambulance took Jason to the hospital, to where a couple of days later he had brain surgery. But that doctor, Dr. E, like we call him, Dr. El Shahabi, he worked out of two hospitals then. He worked either out of Cobb, Wellstar, or out of Kennestone. And now he is associated or affiliated with Piedmont Hospital. And he was telling us, like, when he did that emergency surgery out of Cobb, for one, it was get in there, get it out, get as much out as he could, to calm Jason's brains down, because, it was causing a lot of issues, even though it was a small tumor. And that's what he did. He basically didn't say these words, but he did the best of his ability at the hospital that he was at. Being now going to have his surgery at Piedmont Hospital, they are so much better equipped. He said that when they go in and do this surgery, he is going to collaborate with another neurosurgeon that also is with Piedmont, and they're going to go in, and the technology they have at Piedmont, they can light up or turn the cancer into like I have a hard time saying it, fluorescent color. They'll light it up. And so he will be able to see exactly what is cancerous, exactly what he needs to operate on. And he's saying where it's at, because it's on Jason's right temporal lobe, he can be more aggressive with it. For one, because he knows with, being lit up exactly what's cancer. And he can be more aggressive because it is on his right temporal. It's not in the part of the brain that's going to affect his motor skills or his speech or anything like that. So he can go in. He thinks he can get it all, which is great news. And then while he's in there, the technology that they have at Piedmont that they did not have at Cobb is that they can insert the the chemo wafers, or he said they will either do wafers or they'll, like, the word he used, I don't remember exactly, but it's not intravenous, but it's, intro something, where they will basically shoot the chemo into the recession hole. So if they remove the tumor, obviously you have a space left there. Even if they get 100% of the tumor, there's still going to be cancerous cells left behind. So the point of putting the chemo straight into the recession spot, or the space left behind, is that it will kill any cancer cells that are there. So that's great news. They'll be able to hopefully get it all, and to put chemo straight in to whatever's left behind, and also to the parts that are inoperable. So they'll be able to get direct chemo. And that's one of the things that's so hard to treat about brain cancer, is that you have a blood or a brain barrier around your brain to protect anything that shouldn't be in there. And so a lot of times that blood barrier will reject chemo. And Jason has certain mutations, and I've known a lot of things for a while. That doesn't sound like good news, as far as Jason has certain DNA mutations and the mutations of the cancer that does make it resistant to the type of chemo that he is currently taking. So to know that we're going to go in and put in chemo straight into those tumors, amazing. To know that we're going to go in and be able to get, 90 to 100% of the tumor that's there, amazing. So brain surgery sounds scary, but all in all, I think this is great news. I think that it's good that keep your appointments, always follow up with your doctors, and do what your doctors say. The doctor seems very positive that with post-surgery, still, when he heals, staying on the Optune, and further chemo treatments or whatever, that there's no reason that Jason can't live years. Otherwise, he's a healthy, he said he's a young, healthy man. So yes, it's brain surgery, but today to me was good news. We've got a plan already in action. We have no set date yet for surgery. The other surgeon's office is going to be reaching out to us ASAP. He said it would be this week that we would go and meet the other surgeon, and then they're going to collaborate and I guess set a date. He made it sound like it'd probably be within the next week or two. And we will be doing brain surgery again. But I think it's good, and cannot thank everybody enough for prayers. Please keep praying for Jason. I feel, someone said that you may not can pray for a miracle. Like, for instance, you can't pray that Jason's going to wake up in the morning and his cancer is going to be gone. That's not going to happen. And it's not a lack of faith. It's, realistic, But you can pray for the right doctors. You can pray for your doctors to make the right decisions, and for you to make the right decisions. And I think that's exactly what we've been doing. And I think that, Jehovah has answered a lot of our prayers. Feel very confident about this. Jason did very well after the last surgery, as far as he healed super quick, and he felt better. Like, he felt better after that surgery than he had in the last year. And that is both of our hopes, that he is going to have this surgery, and it's obviously going to relieve the pressure that he's got going on, and whatever that's touching in there that's causing him to feel and act the way he is now. So I will keep updates as far as we know, when we kind of know what surgery is going to look like and when it's going to be. And I appreciate everyone keeping us in their thoughts and prayers, and please continue to do so. Love you all.